We are Team 5, and we are here to present an injectable hydrogel therapy for patients with osteogenesis imperfecta. Osteogenesis imperfecta is a rare genetic disorder that occurs in 1 in every 20,000 births worldwide. This mutation is caused by an abnormality in the synthesis of type 1 collagen, which causes a decreased production in collagen secretion. Collagen is known to be the main protein residing within the extracellular membrane of skin, bones, and other connective tissues, and also contributes highly to the production of osteoids, also known as the foundation of bone tissue. When the production of osteoids is decreased due to its insufficient amounts of collagen, the production of overall bone tissue is also affected, resulting in thin and brittle bone structures. Bone fractures are most common in the femur of 2 to 3-year-old children. So our team plans to target patients with severe types of osteogenesis imperfecta in a younger age group. While this is a rare disorder, it's extremely tedious and painful to live with. Our team considers the treatment of this disorder to be especially important as there are no regenerative medical treatments for osteogenesis imperfecta currently on the market. The only currently used treatments for those with severe forms of osteogenesis imperfecta is the use of an intramedullary rod with an osteotomy to correct bone bowing and defects. You can also take oral treatments such as biophosphates, which reduce pain and overall bone breakdown and damage. However, they do not promote any bone regeneration whatsoever. So, there is an urgent need for an advanced therapeutic strategy that can strengthen bone integrity, reduce fracture incidence, and also improve long-term outcomes for patients with osteogenesis imperfecta.
This scaffold is designed for a minimally invasive delivery using a mini-open approach, just a 2 to 3 centimeter incision to directly access the fracture site. Once exposed, the sprayable hydrogel is applied to fill a transverse diaphyseal fracture gap. UV light at 12.5 milliwatts per square centimeter cross-links the scaffold in just 20 to 80 seconds, forming a solid structure right in place. What's unique is that there is no need for traditional hardware fixation. The scaffold conforms to the defect geometry naturally. Overall, this method reduces surgical trauma and is especially well suited for patients with brittle bones where preserving bone integrity is critical.
The design scaffold is bioactive, promoting both vascularization and osteogenesis within the fracture site. Its sealant-like nature allows it to conform precisely to transverse diaphyseal fractures. Upon UV-induced cross-linking, the scaffold solidifies, providing immediate mechanical support. Over time, it biodegrades in coordination with the natural bone regeneration process, resulting in long-term restoration of bone strength without the need for surgical removal. Slide introduces Gelma, or gelatin methacrylate, which is shown here as the purple matrix on the left. It's designed to mimic the extracellular matrix, helping support mesenchymal stem cells, adhesion, and infiltration. If you look at the table below, you'll see that we used 5 to 10% weight per volume concentration and cross-linked it with UV exposure at 12.5 milliwatts per square centimeter for 20 to 80 seconds. We introduce BTCP microparticles shown on the right side of the slide. It forms the core of the particle and provides calcium ions to promote osteogenic differentiation, essentially guiding stem cells to become bone-forming cells. Introduce PLGA, shown as the outer coating of the particle on the right. It helps control the timed release of growth factors like VEGF and BMP2 to guide endothelial and stem behavior. As noted in the table, it's 10% PLGA and fully resorbs in 4 to 8 weeks, with an initial release within the first 1 to 2 weeks. Endothelial growth factor, which is embedded in the PLGA coating. It stimulates endothelial cells to proliferate and form new blood vessels. Each scaffold contains 750 nanograms with 90% released in the first 24 hours and release sustained for up to 14 days. Bone morphogenic protein 2, which works alongside VEGF. BMP2 helps mesenchymal stem cells differentiate into mature osteoblasts. We used 1 to 3 micrograms per scaffold with 20 to 30% released within the first 72 hours and a sustained release over 28 days to support ongoing bone regeneration.
The main competition on the market is a surgical insertion of an intramedullary rod into the bones of the patient to give it stability and mechanical strength to reduce fractures. This treatment can also be used with fixation plates when there has been a fracture to help orient the bone for proper healing. However, compared to our hydrogel approach, the post-op infection risk is 5.7 times lower. There is no removal surgery, reducing costs and amounts of surgeries needed, and the amount of time spent on the procedure is cut in half, as well as a significant reduction in recovery time. Overall, our hydrogel is a minimally invasive solution for patients suffering from severe osteogenesis imperfecta. This scaffold is personalized and prioritizes bone regeneration at the fracture sites while also reducing the amounts of surgical procedures needed. This solution in the long-term scope is a more cost-effective alternative to hardware-based treatments in the current market. Thank you.